Hello and welcome to the Breathe Podcast, an outreach whose purpose is to support the whole person, the social, emotional, physical, mental, and most importantly, the spiritual you. We are here to influence positive change in our lives and the lives of our listeners. I'm your host, Angela Davis Robertson, licensed professional counselor and counseling supervisor. And co-hosting with me in the absence of Pastor Dale Flowers is
Dr. Susan Thornton, Southern University, and I teach on campus in the clinical mental health counseling program.
Okay. We want you to sit back and take a deep breath, relax, release, and enjoy this special space that has been created with you in mind. Today we're discussing exploring the importance of mental health and discovering your mental hygiene with Dr. Thornton, who's a professor at the University of the Southern University, and the mental health master students. Welcome today. Before we delve deeper into our topic, ladies, I'd like our guests to introduce themselves and give us a little background history of who you are and what you're currently doing. Dr. Thornton, is there anything else you want to share about yourself and what you're doing?
That's all. But, what we are doing on campus is that we are really trying to educate, and we're really trying to get all of our students ready as they go into the field of mental health counseling. We want them ready. So when they sit across the table from someone, and someone says, you know what, I want to hurt myself, or I want to hurt someone else, I want our students to know what to do. When we're sitting with someone who's been abused, who's been touched inappropriately by someone, I want that student to know what to do, what theory, what tools, what do I do to help this child? But more importantly, Miss Angela, I want our students to know how to help themselves. I need to know how to breathe, when to breathe. I want to help myself. I love for my students to introduce themselves.
Absolutely.
All right, we'll start here on my right.
Okay. Hello, everyone. My name is Trinae Mason. I'm a graduating student. I graduated in December in the clinical mental health counseling program. I started this program in fall 2021. Originally, I wanted to go straight into the doctorate program, but other circumstances led me here. And on my first day of class, I wrote Dr. Thornton, and I told her that I was destined to be here.
Yes.
That her class influenced me to become a counselor.
Wow. Awesome. What happened that day, I'm sorry, that made you say I'm destined to be here?
That day, my car broke down on my way to school, and I went to the wrong class. But even after all of that happened, when I got in class, it was just like a breath of fresh air. It just felt like I was supposed to be there.
Awesome.
And you were. You were definitely supposed to be there, and you're still here, but you're about to leave me. Yes.
Okay. Tell us about introduce yourself, please.
Hi, my name is Nylacia Johnson. I am also in the clinical mental health counseling program. I am in my first semester.
Oh, wow. And so this is almost the end of the semester. What are you thinking about that?
I'm excited to continue and work my way through the program.
Wonderful. What did you get your undergrad in?
Psychology.
Okay, that's wonderful. Wonderful. Okay, ladies, I'm just going to start here. We got some research, right? Because there's a lot of research out there. But this one, it says this mental practice initiated by the American psychiatrist Clifford Whittingham Beers back in 1909. He defines the set of practice that we're talking about that allow a person to enjoy mental health and be in harmony with his or her social, cultural surroundings. So what comes to mind when you hear the term mental health or mental hygiene, and why is that important?
Well, let me just start off right now. When we say mental hygiene, a lot of people, that's sort of new. But we all know what hygiene is. We all know we get up and we take care of ourselves, our bodily needs. But now we're beginning to get up and we're beginning to take care of our mind. We're beginning to take that break. We're beginning to say, no, I've got to learn to do that a little bit more. Help me out. We're beginning to step away. We're beginning to read more, get in tune with our breathing. I didn't know about that years ago, that I need to learn how to breathe. I really do. And that's mental hygiene. That's clearing. That's really stepping away. So I'm teaching the students, and I hope that they're learning, we're going to take care of everyone else, but we've got to take care of ourselves.
That's self-care.
And it's finding a routine. What is your routine? Is it reading? Is it walking? Is it sleeping? For me, melting into my sofa. You guys hear me say it all the time. I love just melting into my sofa.
Yeah.
And I have a weighted blanket.
Oh.
There's nothing like a weighted blanket.
Yeah,
Listeners, if you
they're
don't
great.
have a weighted blanket, invest in a weighted blanket. So it's all about that routine. It's all about what do you do for you. And that's just some of the things that I do for me.
And you talked about that earlier, some things that you do for yourself
Yes.
to get yourself, for your mental hygiene.
Yes. For me, mental hygiene is a lot of taking care of my home and myself. It made me realize that a lot of things that I look at as chores is really self-care. You have to make sure that you have a clean living environment, that you have clean clothes to wear, that you have food to eat. So my routine is really taking care of all of those things, making sure my classwork is done, getting some exercise, taking care of my pets, and just making sure that I have everything set up to run smoothly through the week so that I'll be better able to handle the stress and challenges that come with the classes.
Awesome. Would you like to share at all?
Yeah, I can piggyback off of you. When I think of mental hygiene, I think about the wellness of my mind. So it's almost like how we take care of our bodies, what we feed in it, how we clothe it, how we exercise, and how we grow. So for me personally, my self-care includes just time to myself to decompress and process my own emotions, because we do listen to everyone's emotions, throughout the week.
You're graduating soon.
Yes, ma'am.
Really soon,
Yes.
a couple of weeks. And you just started this journey, which is not long. It'll go really, really fast. But what is something new that you've learned concerning mental health since becoming a graduate student?
Something new that I've learned is that mental health, like to me, because we in the program, we think everybody knows about it. A lot of people don't know about it, but people are willing to learn. So a lot of the parents that I come across, they want to learn and they want to know and they want the help for their children. They just don't know where to go or to get the resources. So I think that is something new that's not available for them, like right there in the schools. So they'll be pointing in the right direction.
I'm glad you mentioned that, because when I was in the program, a lot of the time for our parents, it was like taboo. People thought it was taboo.
Absolutely.
And now
Yeah.
you're saying that they're actually seeking, and there are people who are out there who look like you and I
Yes, ma'am.
are seeking help for themselves and their children.
They are. It's like this is something new, but this is something good. But not only that, we have our athletes, we have our stars. You'll see them on television advocating for mental health. Get help, help yourself. And so it's really trickling down since, we watch so many people and we follow them. But now we are really listening because we are saying those words, mental health. People that look just like us. We're saying that. So when I was coming up with my parents, we didn't say it. They had all other type of words that they would be calling people who would have, they would be in the back of the home or Uncle Joe, he's in that back room.
Yes.
But not today. They're out.
Yes.
And we're talking about it. And I'm so happy to be in a program like that we're in. I came through the program myself and I began to pour so much more into me by going to conferences. I'm big on going to conferences. I'm big on learning. And I'm advocating that. I'm pushing that. I'm a pusher. I've always said that to everybody. I'm a pusher. That's me. And
Yes.
I'm advocating for
Yes,
you.
you are.
I am a pusher because I want you to have so much more than I have.
Because
I
you're
want
pushing the right thing.
I'm pushing the right thing.
Yeah.
I'm pushing the right thing. It's all good. But to pour into you, and while I'm also pouring into myself, learning more about mental health, but then learning how to talk to those parents that they're not sure. Our grandparents, because so many of the parents are not even raising their kids. It's the grandparents maybe raising their kids. So how do I get that grandparent whose mindset may be the old way,
The stigmatism,
to learn the new way of, what? Let's get some mental health for these children. You talk about the academics. This is one thing that you're going to learn as you're in this program or any program. You can't even begin to deal with the academics until you've taken care of that
emotion part of
that
it.
social part. That child is in the classroom thinking about parents are deceased, parents are in jail. What am I going to eat tonight?
Out on
Literally,
drugs, yeah.
what am I going to eat tonight?
Where am I going to sleep?
Yeah, they can't think about their academics. They need that mental health to be checked.
Yeah.
And that's what we do. Ms. Johnson, Miss Mason, we listen. I listen all day. I can't tell anybody what to do, but I can help you sort of navigate on what are some of the things that you need to do. So I'm very big on that. It's getting our students to see that.
Yeah. You mentioned about when we were growing up, Uncle Joe's in the back, or
Absolutely.
such as,
Absolutely.
and they moved them to a facility. And we have to realize that we all have stressors in our lives, and we all we put people in the back. At one time we did. And you say you're out, but it's like we all go through different types of stressors, being overwhelmed, and sometimes it gets so overwhelmed that it causes us to kind of break down. But we can be, and you can be, those individuals who prevent them from deteriorating, prevent them from breaking down, so that it's so that they don't have to be placed in a facility, right? It's like understanding, like the medical field have individuals, physicians, or let's say nurses, go into the homes to help with medication management. Well, we're helping with mental health management.
We are, and we have to, but we have to know how to do
it.
That's why you're in school. That's why I was in school. That's why I'm constantly, I'm constantly going to professional developments. I sent out something, I think, on ACEs. I don't know if I sent it out to your class or your class. I did send something out on ACEs. I'm asking you guys to go to that workshop. It's a 1-hour workshop. Plus, that's part of your indirect. But go to that workshop and learn more about ACEs. If you don't know about it, learn about the study. Start with that base. What is ACEs all about? Then once you take that pretest, you may see your ACEs. What are your adverse childhood experiences? What are some of the things that you have experienced? So now when you talk to those students in the school, because he's up and down and he will not sit down and he's always hitting someone, he has ACEs. Let's take that into consideration of what that child has gone through.
And what happens when you take that into consideration, Dr. Thornton?
We have got to develop a different type of plan, because it's not a one-size-fits-all. It is not. No matter what tool you use, no matter what technique you use, no matter how you respond to that student, do I get close to you, or I'm a little bit too close to you because somebody's already been hitting you? I need to sit back. So you have got to develop different ways of approaching people, leaning into people, think culturally, and just thinking what they've gone through. Because if I touch you, somebody may have just touched you last night in the wrong way.
Yeah.
So that's what it's all about. It's just learning what to do, when to do, and how to do it.
So you really, what you're saying is basically establishing a really authentic relationship with that individual, and saying, how do I deal with this person versus how I deal with that individual.
Absolutely.
You're getting to know that individual, what those triggers are, and how do I approach and deal with what's their particular need.
Yeah, I always said we should just ask. Like, you have the person in front of you. Just ask them, how would you like to talk to me? What does mental health look like for you? What does therapy sessions look like for you? What do you want to experience? What do you like to do? So that's normally the approach I go for.
Well, what are their goals? So you're looking for their goals. Well, I love it. It's about each of us getting better. Our clients getting better. The person in front of us. I call it a healing process.
Awesome.
It's a healing. Yeah.
Yeah. We all have to get better. And as our clients are improving and doing better, so that we can get them from that very unhealthy place. When you meet somebody, they're going to be unhealthy. They're not going to be any good. They're going to be unhealthy. We need to get them to a healthy place. And that's the job that we're doing. From an unhealthy to a healthy place.
How do we get ourselves to a healthy place to make sure that those individuals that we're helping are healthy?
We have to identify what's going on. We have to identify some of those issues that we are dealing with. We also have to identify some of those unfinished businesses. What's unfinished? What haven't I dealt with in my life, in my journey? So when I meet a student or when I meet a client that's dealing, let's say, grief, if I haven't dealt with grief, and when I meet that client and I have that unfinished business, it's not going to be good. Unless I take care of me, I'm not going to be able to help that client. Absolutely.
So we have someone else who just joined us. Tell us about yourself. What year are you with the master's program?
Good evening, everyone. My name is Megan Bethley. I am a senior at the Southern University
Yes.
Agriculture and Mechanical College. I am enrolled in the clinical mental health department.
Oh, you're a graduating senior?
Yes, ma'am.
Oh my God, in a couple of weeks, huh? Y'all got like
Yes,
3
ma'am.
weeks.
December 14th.
Are you ready to venture into this world of counseling?
I am ready to jump in and apply all of my learned knowledge.
So, what are you planning on doing after graduation?
I just aspire to be a mental health therapist in a school setting, but whatever else is available.
What drew you to this area?
This specific field, the counseling field.
Yes.
My own adversity when I was, and it's funny that Dr. Thornton was actually mentioning grief, because when I was 10 years old, my father was murdered. He was in a homicide. Yes, ma'am. So I went, initially I began counseling at age 11 to learn how to cope and deal with my new life now. And so since that moment, I've always just been interested in helping people and talking to people.
Was that here in Louisiana?
Yes,
If you don't
ma'am.
mind me asking. And how was your, I'm going to ask, how was the counseling experience for you? For the mere fact that we have some individuals who, especially our little ones in school, said that didn't help me. It didn't help me. So how did it help you?
It helped me to realize who I am as a person outside of what my parents was raising me to be. And losing a parent at an adolescent age, I was very confused, and I just learned how to advocate for myself. I learned how to do the things that I wanted to do, how to speak the way that I just learned me. And that was really important for myself and for my family, because my mom and my other siblings were grieving themselves, and so they didn't have time to help me, and I was the baby, so I needed the most help. So it was just really big.
Did the family go into counseling, or was it just you?
No, surprisingly, it was just me.
Okay. Oh, wow. Well, I am so, you just seem like a very strong individual, and it seems that you're saying that process truly helped you.
It did.
And now you want to help others who
Yes,
are going
ma'am.
through that.
And I can jump in. I've been with Ms. Bethley since she started, her first semester, and now she's graduating. I've seen growth, and that's what I like to see in students. I said earlier when we started, Ms. Rubin, we have Ms. Rubin who's just joined us, and this is Ms. Rubin's first semester.
Okay. Hi.
First semester, but I see growth, and I think I've sent you an email or something to say I've seen growth. I see growth. It is scary to come into the classroom with me for the first time. I'm scared coming into the classroom with me for the first time. I scare myself, but I don't want you to walk out of there not equipped, not prepared, not armored when it comes to talking about mental health counseling. Since I've been here tonight, I received a call in reference to homicide tonight from one of my PLPCs. So they what they did was they called me to consult. My answer was 911. Hang up for me and call 911. So I want you to be equipped to ask those questions and be ready to ask the question.
Because your counterparts in other areas, when they walk across the stage, what Dr. Thornton is saying, when you walk across the stage and say, thank you, Southern University, thank you, Dr. Thornton, the day that you walk into that assignment, that you're going to be ready, boots on the ground, ready, not saying I need training. It's like you need to be ready. And that's what I love about Southern, just being a part of the Southern University campus when I was there, is that we had professors like Dr. Thornton that made sure that when we left there, we were well prepared. So she doesn't handhold. There's a high expectation. And so we want to make sure that when someone said I graduated from Southern that's in this field, that we know that you know exactly what you're doing. It's like just like the nursing. If I have to go to the hospital, I always ask the nurses, so where'd you graduate? Once I knew it's a Southern University graduate, I know we're in good hands. And so that's what we want to know about with our counseling students. So tell us your name and about yourself.
Hi, everyone. I'm
Melanie Rubin. I am a first semester grad school student at the Southern University.
Absolutely.
And what was your background before your master's program?
My undergrad was in psychology.
Okay.
And I got that degree at Southern. I graduated in May 2023.
Okay,
and
so you guys went right into the program.
I was trying to decide, and I called Dr. Thornton, and I was having a conversation with her, and she was like, "Yeah, just go ahead. just
That sounds like her.
Yeah,
That sounds like
her.
Don't take a year off. Just
Oh,
go.
Keep
no.
going.
No.
That's right. You won't regret it. You will not regret it. What attracted you to the mental health profession?
For me, what I went through personally growing up, I experienced a lot of trauma and seeing therapists, and I never had a therapist that really looked like me until I got of adult age, and most of them I would state how I feel, and they would tell me how to feel. So it was very imperative to have somebody look like me, understand where I'm coming from, my background, but also made me feel at ease. So I really wanted to get into mental health, especially to help kids. I know a lot of people focus on adults and say, what about adults? But I always say, Dr. Thornton, untreated trauma leads to more
Absolutely.
Trauma. That's right.
So for the kids is very important because kids are experiencing mental health at a very, very young age, and
Yes.
they try to talk to parents, and
They
parents
don't
like,
understand.
you don't understand what you gotta be depressed for.
Yeah.
I didn't see it with my sister and my nephew, trying to
Yeah.
communicate, and she's just not understanding that is very possible and very real. So it's very imperative that we do sit with these kids and talk about mental health with them.
Well, it really sounds like you all have a lot of strength and resources within yourself on how to help others, your nephew, your clients that are coming up. You have anything?
But just a conversation. We're talking about it today. Look
Yeah.
at us tonight. I didn't do this 10 years ago, 20 years ago. I didn't participate in anything like this. There may be some forums, maybe some open discussions, maybe some programs. But look at us tonight. We're here talking about mental health. And even when you go out to apply for that job, they're going to ask you, well, tell me about you. Okay, you graduated from Southern. Check. You have a transcript, check. But they want to know, what can you do? They need well-rounded people on your job. You tell them, let's put together a podcast. Let's have an open forum. Let's have a group discussion. It's like, you can do something. You can do more, and they appreciate that, being well-rounded.
Because even with my job, I noticed I had to fight, but with my job for the resident assistants, they take on a lot. They have to do class, but they also have to deal with other students' issues and problems. And a lot of them are just be burned out. So I had submitted a proposal where they could at least have, my proposal was at least 3 days out of the semester where they choose, but they had to go to the counseling center first to have that day off.
Wow.
Before they get that day off. And
Awesome.
then after they go to the counseling center, they could have the day to themselves. So it got approved for 1 3-hour shift. And of course, they have to go to the counseling center and talk about it because it's very important. And also having programs for them surrounding around mental health and having sessions because they take on a lot, they hold a lot in.
Yes.
And sometimes their grades fall, or they just, they're one way and then you see them another way and they're like, I have nobody to talk to.
Is that here at Southern?
Yes.
Oh.
In the housing
She's
department.
doing
Good
it
for
here.
you.
Absolutely. That's advocating, and we talk about
Yes.
that. That's one of the first things that we talk about even in the chapter, and that's being an advocate.
Okay.
Being an advocate for the program, for yourself, and for others.
There's that question.
Very important, just about being advocate. Great. This is really, we were just talking just a few seconds before you walked in, just about unfinished business, and I see how you talked about and how you were talking about what you had to what you dealt with, and how you had to get help for there before we began helping others. Now, it doesn't go away. It's always
No.
with us, but at least you addressed it. You talked about it and you brought it up to surface. So that was really good.
Yeah, I still have times where, I always tell you I rate my days. Today I'm at a 4, today I'm at a 3, today I'm at a 2.
Ooh, sound like
That's how I rate-
scaling to me. Somebody
Definitely
knows
sounds like
scaling. Somebody knows scaling.
That's how I usually
Love
rate
it.
my days. But if I drop below a 4, then I know it's very important to understand the triggers. Why I'm going through this, what is causing this. Okay, who do I need to talk to? If I can't get in with my therapist, who do I trust the most to handle my emotions, handle my feelings, handle what I'm going through, where I could be vulnerable with them.
And what if there is no one?
Then if it's no one, usually I play music.
There you go.
Music
There you go.
Yes.
There we go.
Or,
Music therapy, right.
I write, but with me, I'm fortunate enough to where I always have someone. I'm blessed with coworkers who are amazing and there for me. I have the counseling center right there
There you
by
go.
me.
Right.
I have a number of people that I can reach out and that I can trust. So I'm lucky in that instance. But for those who don't have it, music, writing your feelings,
Walking.
walking, take a minute, stepping away, being in a room,
Dancing
just
like
breathing,
no one's
just-
watching.
Yes, it's just so
Absolutely.
many methods, and a lot of times people don't realize they do it. Like, even if you have to step away from the situation and just like, I can't deal with this right now, and take a moment, taking
Yes.
a nap.
Oh, love those.
Absolutely.
Yeah.
Love the naps. Love, we talked about that earlier. Love that sofa of mine and my weighted blanket. If you know anything about me, I have a weighted blanket and I just absolutely love it.
Love it.
It's really great.
And I say that I'm so glad that you do have someone, but I really wanted to. There are so many people who say, I don't know who to call, or I don't have anyone. It's me, or nobody cares, because we get into our mind that it's just us sometimes, right? And it's like feeling rejected, feeling lonely, a lot of loneliness out there, or people feeling that way. It's like, however, there are things that they can do, and I'm so glad you mentioned that there are things that they can do without anyone else around.
They even have, I had to do it for a field experience in my undergrad. It's called 7 Cups. And they could go on 7 Cups and you talk to somebody. Somebody is on there where you could talk to them. You're typing back and forth. You don't know the person. They don't know you. So you could vent if you need to vent.
Great.
And get advice or whatever you see fit that you need at the moment.
Is that a more of a typing chat?
Yes, it's
online.
a type of chat. It's
It is.
online. It's 7cups.com.
Okay, I hope you guys heard that. 7cups.com. If you feel like you don't have anyone, but you feel that, hey, or I'm afraid to tell anyone else what's going on with me, you can do that. So thank you for sharing.
Thank you for that resource.
Yes,
I
that's a
definitely
great
will.
resource.
7 Cups. I've heard about it.
Yes. Yeah, Dr. Thornton.
Okay, so we
The
talked.
advocacy.
Say it again.
No, I was just saying advocacy.
Advocacy. We're talking about advocacy, and that's one thing that we cover in the classroom. We're talking about advocacy. So, if you had to, what are some of the areas that you would love to see improved? So you talked about Southern University and you did a great thing for them. What about just in your community? Go back. Let's go back a little bit. What are some of the things you would like to see improved?
Just in a community that Black people have the stigma surrounded around mental health. I don't want to talk to nobody about my problems because, we grew up, well, let me not say we, but most people grew up with the mentality, what happens in this house stays
in the
this
house.
Yes.
Pray it away. Just pray.
Oh yeah, pray. It's gonna
Pray it away.
Yes.
It's gonna
Pray it
get better.
away.
So
Right.
That is one stigma that I would like to see in, because it's very important. It's okay not to be okay. We
I
taught
say
that
that
you have to
often.
be strong and everything, but it is okay
not to be okay. But it's not okay to stay not being okay.
Right. That's when you got to reach out and just get some help. But we've just been joined by another
Yes.
first semester student. Tell
Yes.
us who you are. Come on, jump on in this conversation on mental health.
My name is Alyssa Ha, and I am a first semester student at Southern University and on the clinical mental health counseling track. And it's just been great being here and just especially being under Dr. Thornton and learning so many things.
Well, Ms. Ha, I'm surprised you didn't run out the first day because I wanted to run out myself. I tell everybody, this is my one thing I say, if I were you, I'd drop this class. I would drop. Anybody who's been with me in class, they know I say, if I were you, I'd drop this class. Because I'm not going to stop. I'm going to push. Because I want you to have it all and more than even what I have or the experiences that I have. Is just so important to me. So
Where are you from?
I am from New Orleans, Louisiana.
Okay.
I didn't know that you were from New Orleans. Oh my goodness.
New Orleans. Okay, what brought you into the counseling program?
You know, I've always been such a listener, and you meet so many new people. They're so beautiful, such beautiful souls, and you understand that they have such a dark past, And, it makes you really want to assist people that are going through the same things and just assist them further in life just to get to where they're comfortable and just seeing them achieve new goals. So I was definitely interested in helping people find that for themselves. And of course, I have been through some things myself. So I always want to see the best outcome for others.
I love that because
That's
everybody
good,
about everybody we've spoken to. I just want to know, let everyone, all of our listeners know. I want you to know that we are having musical chairs that's happening.
Absolutely.
And I love it because
I
you hear all the
love
different
it.
voices. You hear all the different individuals, their background. And 9 times out of 10, the reason why we are here is because we believe that each of us can do so much better, and we want to be an advocate for individuals who are going through. It's like you don't have to stay in the space that you're in.
No.
You can get better. Let's use this as a stepping stone.
Absolutely.
Yeah, so thank you so much for sharing. We also have another young lady who has joined us.
All
Introduce
right.
yourself, please.
Come on up.
Hello, I am Kimberly Sewell, and I am a clinical mental health counseling student. I'm in my last year.
Wait a minute, Kimberly, you graduate in the fall?
Fall of 2024.
Oh, I love it. Are you
She's
excited?
leaving us. She's leaving us.
So, Kimberly, I know you're from this area, right? Did you grow up in this area or your family?
My family is from Scotland.
Okay, so you didn't grow up in this area.
No, I did
Okay.
not. I'm from Baker.
You're familiar with the area, though.
Yes.
Okay, tell us, why did you get into the mental health field? Why you're interested?
Okay, I got into the clinical mental health counseling field because I actually am a social worker. And I was employed in the clinical mental health counseling program, and it just made sense for me to continue my studies. And so while I was working, I decided to go back to school to get my master's, just to build upon my foundation as a social worker.
I love it because I was actually there when you started. I think I had been there I was only there for a couple of classes because I had gotten my mental health. I got my school counseling master's back in 2009.
Yes.
But when I moved here in 2016 back home, I'm like, well, I really want to do mental health. That's the reason I went into counseling. Mm-hmm. But I didn't have anyone like Dr. Thornton to kind of walk me through and tell me, here's the things you need to do. Mm-hmm. So here I got a master's in something I was never, ever going to do, which was school counseling.
Mm-hmm. Absolutely.
And so when I got here, met Dr. Thornton, and yeah, she was just as tough
Yes.
on you
I
guys
am not
now.
tough. Am I tough?
I would like to say, especially being a first student under Dr. Thornton, it was a different type of challenge, but it was what
It's the
pushes
right
you
kind.
forward.
Yeah,
Yes.
it's the right
it
kind.
It encourages forward, yes.
Yeah, and we were talking about her being a pusher. We
I'm
know
a
what
pusher.
pushers are,
Yes.
but we're like, she's the right type of pusher.
Yes,
It's like to
definitely.
get
It's
you
a good
better.
challenge.
Yeah.
Yes.
We want you to excel. You are graduating from the Southern University, and we have people out there who are doing excellent work.
Absolutely. Excellent
Yeah.
work. They have their own businesses. They're
Yes.
entrepreneurs. They're in
Doctors,
so
yeah.
many different fields.
Fields,
We've
yes.
talked about so many different fields, and you even talked about a particular field. It's just not it is mental health counseling, but there's so many different areas that you can work in. What were some of the ones that you talked about in class?
One that I talked about was about substance abuse.
Absolutely. So you work in the substance abuse field. You can work in equine therapy. You can work in a hospital. You can work in an office. You can have a private practice. The door is open. I work in a school. I'm in a school setting.
Okay.
I am not a school counselor. I don't even touch that. But what I do is I have an opportunity to sit down in front of a child. They're going to tell me what's going on with them, what's hurting them, and my job is to listen.
Yes.
That is my first job. I've got to listen.
Yeah.
And once I listen to them, then I need to help them figure out what's next. What do we do? Then I need the right tool, the right therapeutic tool. Everybody doesn't want to play in the sand.
No.
Sometimes I don't want to play in the sand. But I have to have the right therapeutic tool. I have
Oh,
a little
that's
girl
right.
we're working with. Mom's incarcerated right now. And so she's between houses. So we have a dollhouse where sometimes she's at this house and sometimes she's at another house.
Okay.
That's not the right tool for everyone. So that's what I like about this program.
beautiful.
I love being hands-on. I just love the preparation. I'm a big pusher about conference. Ms. Hart heard me say it over and over and over and over and over. Let's go to conference. Please go to the conference. Network.
Yes.
Get off work enjoy yourself, have lunch.
Yes.
And that's so good just to grow in this field.
Yeah, professional development
Oh
is
my
like
goodness, you have to.
critical. Things are
have to.
changing rapidly, but you want to stay on top of what's the things that are happening in our field. Yeah, so one of the things I want to kind of address is when we talk about school counseling is that I was a school principal in Colorado, and one of the things I did use my school counselors for, Dr. Thorne, was for some of the social, emotional, mental health things. But 9 times out of 10, that is not what the school counselor's job is. So I'm really excited about what's happening in education now, where they are hiring
Yes.
the mental health supports. Like Dr. Thornton, in her job, she's able to support those students
Absolutely.
who are needing emotional, social help. But I know the district is now, this is East Baton Rouge District, is now also hiring mental health counselors and social workers. Is
They
that
are.
right?
So if you're looking for a job, they're hiring just for mental health. So we have the program that I work in. I'm in the school with mental health. Then we have the social workers, and we just have mental health.
Yes.
They're hiring.
For
they
just
see
that
the value.
purpose.
That is it. They see the value
That's
in
so
coming
huge.
in.
But look at
Absolutely.
the levels of supports now they have.
We have
that
the social
happened.
emotional
Yeah.
department. We have a social work department, and we have the mental health department, and we
Yes.
have the prevention department.
Yeah, so that they're just layered
Layers.
layers of
Layers.
support for
Yeah.
our students, and I think that is so critical. And I want people to be able to utilize it and understand
And they do.
that support inside the schools.
They do. They're using them. Principals are using us. So it's not now just about suspend, expel. Give that child an opportunity to circle back and talk to someone to see what made you hit someone, walk out of class, curse out a teacher. So when they have an opportunity to just talk to us, there's always something underneath. They didn't wake up wanting to just go curse the teacher. There's something underneath, and that's something that we do.
Yes. So, Miss, what do you want to do with your counseling?
Well, eventually, I do want to open up my private practice. That's the end goal. But while I am employed at Southern University, I would like to expand my current role, where we do provide mental health services within our college. So that's
Okay.
kind
Oh,
of
wonderful.
what I would like to do with my degree.
Oh, I love that.
Well, and not only that, I hope to see it even in the athletic department, in the sports.
yes.
I want to see
It's huge
everyone
there.
Talk about needed,
Yeah.
because they look at television and they see all these players and it's like, oh, that's going to be me, but it's not going to be everybody.
No.
Right.
Everyone is not going to have an opportunity to sign that multi-million-dollar contract. So you've got to get that education.
Yeah, the education is so critical, but also the social, emotional, mental health is so critically important for our students who are coming in from all over our country.
Well, yeah,
to be on campus.
Yeah, and they're away from home.
They're away from
and they're away
home.
from community. They're away from their church family. They're away from a little bit of
And things
everybody.
are still happening back home.
Absolutely.
Lives
And they're not there.
are being
Absolutely.
interrupted back home,
Yeah.
and they can't get back to what's happening.
No.
Right.
So that's a distraction and a destroy for them as well. And so being able to be within that department. Now the NFL is also hiring
Mental health work.
Yes.
Mental health workers are being hired
Everywhere.
everywhere. We have got to have these mental health workers, and it's so good to have, and we will have them.
Yes.
And we're joined by someone else.
Yay! Tell us about yourself.
Brand new into our program.
How you doing? I'm Mike Triana Rochon. I'm a first-time student in the clinical mental health program. This
Okay.
is my first semester, first year.
I'm asking everybody. So why mental health? Why do you choose it?
I feel like it's not really talked about for the young adults, especially just working with juveniles at one point. I realized instead of like asking what's wrong, what's the problem, they were so quick to probably say, oh, strike 3, you're gone. Not really saying, okay, why is, he or she doing this? Why is he or she feeling like this? They never really pinpointed the problem.
It sounds like they don't even want to take the time to find out what's going on. They just want to just send them straight to some
Whatever,
kind of
huh?
incarceration.
Consequences.
Right. Yeah, not find out what's going
Well,
on.
a lot of times I realize the kid has not even been properly trained in what the response should be.
Exactly,
You know,
emotional wise.
They don't know, so we haven't even gotten there yet. So
We haven't gotten there yet.
So you want them to behave. How have you shown them how to do that? Have you trained them how to do that? Do they know what that looks like?
Not,
No.
not if they haven't had a good role model.
No,
But before we
right.
go any further, we
Yes,
have
we have another one.
another student who's just joined us. Come on up to the mic and tell us who you are.
Good
First
evening, ladies.
semester. Good
Hello.
evening.
Yes, my name is Michael Rowan. It's my first semester. I'm on the clinical mental health track. I graduated undergrad at Southern University, the Southern University in psychology.
Yes, yes. Well, welcome to our world.
Absolutely.
What made you do this?
I'm the unofficial mental health go-to person in my neighborhood. I'm like the hood therapist.
Where is this?
Yeah.
Stroma area, Dixon, North Baton Rouge.
I love it.
805.
And it's a male.
Uh-huh.
We don't see enough of you in this field, so it's really good to see you and that you are the go-to person in that area. So the good thing about that is that you are going to get the skills. You're making sure I am skilled at what I do. I'm licensed at what I do.
Oh,
was
let's
the
talk about
unofficial part.
license. Absolutely. He's gonna they will all be licensed. I'm big on license. Ask them where to go to get the license.
Tell us about
They
that.
know. I know they know.
You know about this licensure here in the state of Louisiana? Talk about that.
We have to go to the LCP board.
LPC.
LPC board.
That's it. He'll get it. That's right.
Yeah.
There's a process. So, yeah, start your process now. So when you graduate, you can put that paperwork in to be a licensed clinical therapist. Love it.
Absolutely. And just to earn all that different money. And we were just talking about all the different sites. We talked about in class, from equine therapy to substance abuse to mental health. And what was your area?
Family and marriage.
There we go. I didn't even
Okay.
mention that one. So
That's the one you had to look into.
Yes, ma'am.
Yeah.
My chapter 8.
Chapter 8. That's right.
Have you ever have you presented on it yet?
No, ma'am.
Okay. Are you
you
ready to
haven't yet.
present?
Next week. Yes,
Okay.
I
All
am.
right. He'll be ready.
Have you
next
done
week.
some research?
Yes, I have.
Can you tell us a little bit tonight?
Well, I can tell you they don't make that much money. I can tell you. I can tell you they're probably like 11% look like us.
Okay.
Okay.
67% people that don't look like us in that field. More so, those numbers are more so mental health counseling and not specifically to family therapy, family and marriage therapy. But in Louisiana, it is still a small number.
It's a small number. And
Very small.
what are they seeing couples for? What are they seeing couples for? What are the issues that you
marriage situations
like money?
I can see it. Communication, lack of
Communication.
communications, trust is also a good one.
Infidelity.
It could be a little bit of everything.
Yes, amongst all
Yeah.
those topics right there.
Yeah.
for sure.
Okay.
And then just that's not my particular area. I didn't go into that area. I found my niche. And once I found my niche, that's what I did. I just continued to pour into what I was interested in, and that's what I tell you about. I'm very interested in play therapy. Excuse me. Very interested in play therapy. I go to play therapy conferences. I'm looking at the CEU. So when I'm in front of a parent or a grandparent or a principal, I can talk about it, and I know what I'm saying. When we start talking about something that's out of my lane, out of my area, then I'm going to refer them to someone else who has the expertise, in that particular area. So
What
that's
area
what I want you to do.
are you interested in?
Not family and marriage is actually not where I'm at. I'm more into the mental health and substance abuse area.
Okay.
Have you heard of Roy Mitchell before?
I have
Rest
not.
of Dead. He passed maybe in the past 2-3 years or so, but he used to work with juveniles and people through the court system.
Okay.
He did like the effective decision making classes and stuff like that. So he was able to help people that needed second chances, not the average people that need, because there's a lot of us that
Yes.
need, but he was actually helping a different dynamic, and that's kind of the area I think I want to go in.
Awesome. And they're very receptive to you. So you're like, I love that.
Something like that.
No, your people are people that's in the something like that in your area where you are now.
Yes.
The neighborhood counselor.
Yes. Well, like I said, it's definitely unofficial because
I know
that's
we know
my whole
that.
point of going through
We
the
know
school and-
we know it's unofficial.
Yeah, getting blessed with somebody like Dr.
But being able to find someone who can direct them somewhere else or a listening ear. You still could be in a listening ear.
That's what it is for the most part, a listening ear. And I get along with people that had these situations. They may have been institutionalized or hospitalized rather, and I have a different rapport with them for the most part.
So what's your area that you would really like to focus?
Mainly trauma, depression, things like that. Because I feel like it's not talked about. Depression definitely not talked about. Mainly like whenever you open up about depression, some even like our parents, they kind of be like, oh, what do you have to be depressed about?
You're right.
They don't really ask
You're
the
right.
question of what's going on. Let's
Right,
sit down and talk.
right.
Yeah,
Yeah.
they kind of like just shove it off, and that puts you in a place of, now I'm more depressed.
More depressed.
Because where exactly can I go? If my parents can direct me, then who can direct me?
And you ever think about it? They may not even know what to
What is
say.
Exactly. And that's how I try to see that sometimes most parents weren't raised how we were or didn't get the experiences, the same experience that we had to really tell us how to do things. They
Yeah.
weren't really raised on emotions just as well as everyone
Right.
else. So that's why I kind of think like, okay, it's not my parents' fault.
No,
They went through
it's
things
a great
just like,
time to educate.
Exactly. So they went through things just like everyone else. They don't understand just as well as us. So
Yeah, we have to get up.
yeah,
and
so
keep
exactly.
going.
Maybe I need to open a book. Maybe I need to do some research. Maybe I need to get my master's in mental health so I can carry on the legacy.
Yeah, the legacy and just really educating our community on what that looks
Exactly.
like, what that feels like, and how to come out of it. Because some people don't realize that they are having a depressed state.
Exactly.
It's like, because this is my normal way of living, and I've gone through things before, and I have to just keep on pushing.
Exactly.
So educating them on like, you can push, but you don't have to push with that heaviness and that burden that's carrying you right now. So yeah.
I would like to ask the students this. Here's my question. Tell me about your strengths and resources and how they might help you. So in other words, what are you bringing? What are you bringing to this table tonight? What are you bringing to the program? For me, the gift of gab. Sister can talk. Let me just tell you, I can talk. Half the time I don't know what I'm talking about, but I can talk. And I have that strength with talking. I don't mind talking. But that's not everybody's strength. And that's okay. So my question to you, what do you bring? What is your strength? Mike Toronto, what are you bringing?
Being a safe space. A lot of people don't have a safe space. So I feel like I would bring that more than anything, because just because people can sit down and talk to you, they be like, okay, I don't think she's listening. I don't think she understands. And also having the strength to respond to the right things so that they can have understanding of, I can get through it. She said I can get through it. I know that I can get through it because she's pushing me. So safe space is definitely one for me.
I like that. Miss Rowan, what are you bringing to the table? What's one of your strengths you think you're bringing to the table? And then what's a weakness that we need to work on? Because I have a lot of weaknesses. Just look at my closet. You'll see some weaknesses. But what about a strength that you're bringing to the table?
Escuche muy bien. I listen very well.
Okay.
I like to try to take in what people saying, because everybody want to be heard, but everybody don't process the information that somebody giving them well.
Okay.
They just, more so it seems as if they just want to tell you a relating story or something. So I just try to work on listening a little more. Before as a weakness, timing. I think I told you that before. Timing is one of my things I'm working at.
Like timing in what way?
And being responsive and in my strength of listening. Sometimes my timing is off in a response method. Okay. But I do know that
you're
I
processing.
listen well.
Yeah.
I'm still processing. Sometimes it might be a little early, but the timing is what I'm working on for the most part.
That's a good one. What about a weakness you're bringing in that you think you need to work on in this program?
Knowing exactly when to respond and saying okay, sometimes people just want you to just listen. So me just, let me hurry up and just give this advice, not knowing they probably have more burdens they want to say, but I just want to quick to say, well, let's solve this one first. I need to learn when to respond, when is the time to respond, and when is the time to give them exactly what they need. Instead of just feeling like, okay, I feel like you need this right now. More so just realizing that maybe they don't need it right now. Maybe they just need a hug. Maybe they need me to just be like, okay, I'm going to sit here, I'm going to cross my legs, and I'm going to let you finish first. But I'll always be quick to say, okay, since you said this, let's do it this way. But maybe they don't need a self-care day. Maybe they just need, like I said, a hug. That's really it. So
you can always ask the person too. What it is?
Yeah,
what
exactly. Instead of just doing an I
Yeah.
thing. Like I just feel like so make it seem like what
and
they
one,
need.
And one thing I really want you guys to remember is that we as counselors don't give advice at all. Right?
Exactly.
We don't give advice because they have the answers within them.
They do.
And we just have to get them to start pulling it out.
Yes.
We are there for them to get that answer out of them because they have the wherewithal to do it. So we are not advice givers. We want to remember that.
That's why I feel like it's just a weakness for me personally. What's a weakness that I need to get over? What I need to get over before I can continue in this field. I need to know that it's not about I, especially as being a counselor.
Awesome. Okay, so we are at a point where we're going to take a 2-minute break. Thank you all.
Sounds
you guys bring so much energy.
Absolutely.
We're loving the conversation. We'll be back after a 2-minute break. Thank you.
I'm Dale Flowers, pastor of the Redwood Baptist Church, located at 20912 Macos Road here in Zachary. And on behalf of the Redwood family, I want to invite you to join us for worship this Sunday morning at 8 a.m. Redwood is a church where the love is felt, the praise is authentic, and faith is strengthened. So please come and be our guest. We're looking forward to seeing you. God bless.
I'm growing socially, I'm growing emotionally, and I'm growing mentally. I'm strengthening myself through having healthy relationships, finding healthy outlets that causes positive impact in my life. Each individual life, in the life of our program, in the life of the individuals we serve. Hello and welcome back to the podcast, the Breathe podcast, an outreach whose purpose is to support the whole person, the social, emotional, physical, mental, and most importantly, the spiritual you. We are here to influence positive change in our lives and the lives of our listeners. I am your host, Angela Davis Robertson, licensed professional counselor and counseling supervisor. In the absence of my co-host, Pastor Dale Flowers, we have here tonight master students from the Southern University Mental Health Counseling Department. So you guys, I want you to introduce yourselves.
Oh, my name is Diamond Janice, and I'm in the Clinical Mental Health Counseling Program, and this is my first semester.
First semester, all right.
Okay. My name's Ian Roadhorst. I am also a second year Southern University grad student.
Oh, second year, that's right, Ian. Second year.
Hello, I'm JC. I'm a clinical mental health counseling student, and this is my final semester.
Okay, so we've been talking all night with your peers, your colleagues, that's what we call them in the master's program. We've been talking about, just mental health. Well, tonight we're talking about not just exploring the importance of mental health and discovering mental hygiene. I just want to know, how do you connect with you? Because it's important as mental health professionals that we're able to connect with ourselves. We're trying to help others connect with themselves, but how do you connect with yourself? Anybody can answer that, and you all can answer.
So I'll start. For myself, I would say meditation. I think everything starts with the mind, so being able to breathe and channel that just positive energy and kind of slow my thoughts down. It just gets me in a good headspace to be comfortable, to relax, even just to take a nap or just take a load off. So I would say that's my thing. Also, just like a breathing technique, when things kind of get frustrating, I just try to breathe through it and just keep pushing.
Keep pushing. All right.
So for me, connecting with myself means self-care.
Okay.
Self-care is a big thing that I try to push. It's something that I think everyone can benefit from.
How do you care for yourself, Ian?
For me personally, just anything like reading, taking a nap, just taking time out of my day to make sure I'm relaxed and healthy.
Good. Yeah.
I take care of myself. I start with spiritual self-care. I like nature. I like the sunlight. I do like to do deep breathing as well, to be in tune with myself as well as my feelings and emotions. And I think praying to me is important as well.
Absolutely. So what we start with, That's our foundation, our core, right? So tell me, why did you guys get into the counseling program? What drew you to this area of life?
You can.
Okay. Well, for me, I actually kind of dealt with a lot of low self-esteem issues as a teen, just trying to kind of identify myself, trying to figure out what do I like and not like. So I ended up to the point where I didn't really recognize myself. So I was very depressed, and I had attempted suicide multiple times. So for me, it's personal. I am what I needed to be
at that age. I want to be the person who can save myself out of that situation, and then just to save the little girl who's, you know, coming behind me that may be struggling in the same way. So that definitely fueled it. I actually went to Scotlandville Magna High School, where eye care was very
instrumental, huh? Yeah, you understand that, yes.
Yes, and it's needed. But I got my opportunity to kind of get into the field, volunteer, and just see the impact, and that's what made me get into it. Each and every one of us that's here tonight, we're needed in this field. We need more people in this field, and like it can go on and on and on. Like I needed that person, so I want to be that for somebody else.
Did you have a counselor? Did you have to go through? Are you just kind of?
So I would say for my cultural background, of course, as an African American woman, talking about counselors and things like that, it wasn't very prevalent in, you know, my household and around my family and things. And it was almost like a hush hush, like you can't go to the counselor and tell them my business, and you're gonna get in trouble about stuff like that. So as a child, I think it was very confusing, not really knowing what part of my truths to show and what's not supposed to be said outside of the household.
So you never could go be truthful.
Yeah,
you could never heal because truth is healing.
Yeah, and then also I would say, like telling my mom something, it would be kind of like, I don't know, she would make my problems kind of feel small. Like I have to pay bills, and I understand that as an adult now. Like I have to pay bills, I have all this stuff going on, and you're a kid with no responsibilities. Why are you depressed? It was kind of like the attitude. And now that I'm an adult, I understand, but I still have to empathize with the child who just needed to talk about her day. Or talk about the girl who might have, you know, picked on her. Or
call her name. And you're absolutely gorgeous. It's something that, you know, we as girls, I don't know, we as girls kind of go through things like that. And then, unfortunately, we talk about each other, you know, other girls, like, but you're all are beautiful. So I'm glad you're in the field. How do your family feel about that now?
Well,
are you able to educate them at all?
It's 2023 now, and I will say this: my mom is now a psych nurse practitioner. So
there you go.
I would say over the years we've definitely broken
evolved,
those barriers,
Yeah.
evolved as a family, broken those generational curses, and we're just trying to push it forward and just, you know, take our family with us. It's great to pass great things on generationally. We don't want the curse to be passed along all the time, you know?
That's right. All right, Ian, tell us. Come on.
Okay. For me, I relate to you a lot because it's also very personal for me. Whenever I was in undergrad at Southeastern, I started to go to counseling because up until I was 19, I was in the closet. And my counselor was actually the first person that I came out to. So she was the first person I was really able to open up with and share that part of myself.
Yes.
And so after, you know, I graduated, I wanted to be a counselor like her and be someone that, you know, like an outlet.
An outlet, yes.
A safe space.
Safe space, honest space, somewhere people can share and feel free to do that and feel vulnerable. Because that's our most vulnerable selves when we're sharing, opening up, and it's fearful. I'm sure that was just such a scary thing for you.
Yeah.
And your family didn't know?
No, she was the first person.
And she helped you kind of break it to your family?
Yeah. She told me whenever I was with her, she was like, you're a very proactive client, because I did most of the work myself.
Good.
Because I just wanted it to be over with, so I was like, I have to go to counseling, I have to figure this all out, and she helped me sort of go through that journey.
Yeah, I love it. Oh, I love it. What tell us about you? What brought you to this area?
For me, it began in the school setting. I believe it was middle school. I was picked on a lot, and it had to do with my skin color.
Welcome to the club.
So being singled out for being a darker tone, and then growing up and observing the same thing, it's still continuing on years later. And so being able to provide that support, being able to provide empathy to others who are experiencing the same thing, as well as good listening skills. that's what brought me to this.
Awesome. Well, you're here for the right reasons. That's number one. We all have our personal experiences. Number two, and we care that others they're gonna go through the same things that we've gone through. You just said that. Look, I'm old enough. I won't even say old enough to be your mommy for sure, for sure. But here I am, old enough to be mom, and I went through that. My mother is 80 plus. She went through that. So it's not that it's not gonna. We're living among human beings. We're going to continue to do things that hurt other human beings.
And so learning how to cope.
Not just cope, but understand who we are. Yeah. What you said is like, I know who I am. Knowing who you are, being okay with who you are, and owning who you are makes a big difference. It building that confidence in an individual, building that self-confidence, self-awareness. I'm okay with me. And so when I walk in at a certain way, I'm telling you how you're going to treat me. Mm-hmm. And if I'm walking with a certain air, there's going to be something that tells you, don't step this way in that manner. Does that make sense? Mm-hmm. So when you know who you are,
It's like come correct.
Well, again, we are human beings who have energy. Mm-hmm. And when we understand who we are and we have that energy, and I'm not saying my energy is saying like, don't mess with me, my energy is like, I know who I am. I'm okay with who I am, and I feel good about myself. And so I'm giving off really good energy that someone on this side may not like, but they're going to stay the distance because I have no fear about who I am. Mm-hmm. It's like a dog on a street. Why would they run behind some people and some people they don't? Because you're pushing off an energy of fear, so that dog is going to chase the person who's fearing. Does that make sense? Right. So the person is coming to you because you're pushing off an energy of fear or low self-esteem, and they don't know it, but they're feeding off of what you're giving them. Does that make sense? Yeah. So get that energy right, understand who you are, and help them build their energy, help them build who they are, helping them build their self-esteem. That's what we're here for. Yeah. Helping them come into their truth. Like Angel Reese, she says, what? I am unapologetically me. I'm okay with that. So be unapologetic who you are. Okay, let's talk about how are you prepared how prepared do you feel that you're ready to enter into the profession, because you're the one who's graduating, right?
Yes.
How prepared do you feel?
I feel pretty prepared. I always feel like there's more that I can always learn. There's more ways that I can continue to grow. I know that I've been prepared with the professors that I've had, the instructors. They have done really
awesome.
Well. But I know that I'll continue with the trainings as I go along.
Professional development, Dr. Thorne always talks about that. Always, that she's always pushing, getting better, sharpening our skills, networking with others who've been in the field, who are in the area of what what you're feeling. You have one more year in.
Yes.
How prepared do you feel?
I feel pretty prepared. I'm currently a practicum student at the Bridge Center for Hope.
Okay.
It's a crisis addiction center, so I've learned a few things since my time there.
Yeah, and listen, you're all ready because we've gone through it.
Right.
We have experienced some things. So you're ready. You're just getting your credentials, getting your licenses to be ready.
You're just learning it from the other
side of it. Yeah. Mm-hmm. And you're licensed to do it. Mm-hmm. Right. Here in Louisiana, you have to have a license to do that. Mm-hmm. Anything you want to share with us? I think we're at our end. Anything you'd like to share before we leave?
I just want to thank y'all for inviting us. It's been
absolutely
nice.
So good I didn't know how the musical chairs was going to work, but I absolutely loved it. Loved it. Anything you'd like to share?
I'm glad to be here, and I really love what you do.
Thank you. Thank you.
I love the podcast as well, and just be in tune with yourself. Check on your mental health. Check on your friends.
Yes.
Check on your loved ones.
We want you all to be better. We are so glad that the Southern University is in the house. I'm so proud of the students. Thank you so much, Dr. Susan Thornton, who does such a great job with the students up there. She's going to keep pushing you, but it's to be better, right? It's about quality, being quality, putting out the very best product that Southern has in the mental health department, and that's you all. So thank you so much for being here. Thank you all for listening. Go and be awesome, you all. Have a wonderful evening. Take care.
Thank you again for listening to the Breathe Podcast. Follow us on Facebook at Growth Services of LA so you never miss an episode, or if you want to hear it again. If you would like to learn more about what we do, visit our website at www.growthla.org or give us a call at 225-300-4943. Join us next time so you can alter the way you live your life, change the way you think, and better your health.